While more and more people are getting long-term health problems from COVID.
That's according to the latest CDC report showing 1 in 5 adults have a health condition that might be the result of having COVID. Fox 12's Audrey Wheel spoke with several people who've been sick for 2 years after being infected, and she joins us now live. Audrey?
This is so incredibly frustrating, as you can imagine, for the people who are still sick. The CDC says that the most common lingering symptoms are respiratory issues and things like muscle or joint pain. Now, several Portland hospitals do have treatment programs or clinics to help these people with long COVID, and they've seen hundreds of patients just in the past year or so. We first spoke with Chelsea Aliona in 2020 when her COVID symptoms were relentless.
I'm doing substantially better than I was a year ago or even 6 months ago, but still have residual symptoms such as brain fog, fatigue, intermittent temperatures.
She's now back to working full-time remotely and has gotten back to some of the things she loves, like hiking and paddleboarding, even though they're still difficult for her to do.
The fatigue is just like a blanket of weight on me all the time.
Julie Fisher is in the same boat. She got COVID while working as a traveling nurse in April 2020 in Connecticut. She stayed in a hotel for 6 weeks and took multiple trips to the hospital until she was finally able to come home.
And so once I tested negative, then, workers' comp was like, okay, well, you're all better. You can go back to work. And they stopped paying me, but I never got better.
2 years later, and after trying every therapy she can think of, she still has symptoms.
I still haven't gone back to work. I've gained over 100 pounds just because of the inactivity. Like I can't do anything. I can do activity for about 4 minutes. And then my low back just starts spasming really bad and I get out of breath really fast. I still use oxygen at night.
She's also getting testing through OHSU's long COVID-19 program, which has cared for 750 patients since it started in March of last year. Kaiser's had more than 600 referrals at its long haul clinic, and Providence has seen 500 patients ranging from kids to people in their 90s. The CDC now estimates 1 in 5 adults 18 to 64 have a health condition that might be from having COVID, and that's 1 in 4 for people at least 65 years old. Anything from brain to heart to breathing issues, kidney failure, or blood clots.
It is not at all surprising to me. I think any long COVID survivor knew that this was coming. We predicted it almost from the beginning. And I am extremely heartened by anybody else who has to suffer from this.
I'm just hoping and praying that eventually I'll start feeling better.
And this CDC report is in line with other studies that have been done, some actually estimating that closer to 30% of adults who've had COVID now have long-term symptoms. Reporting live in Southwest Portland, Audrey Wheel, Fox 12 Oregon.